Hi, I'm Dr. Keith Volstad.
And I'm Laura McLeod Volstad of Volstad Chiropractic and Integrated Wellness. We'd like to welcome you to this week's edition of the Chiropractic Corner, a weekly show spotlighting the chiropractic profession and what doctors of chiropractic do to improve their patients' health. In this program, Dr. Volstad and I plan to cover topics that pertain to your health from a complementary and alternative medicine point of view. These topics will include spinal injury issues like neck pain, low back pain, bulging discs, pinched nerves, and sports injuries, lifestyle medicine, dietary and nutritional advice, nutraceuticals, and supplementation, just to name a few. We'd like to encourage you to email us about topics that you'd like to hear discussed on this program. You can do that by emailing us at Chiro1, the number 1, at gmail.com. That's M as in Mary, CHIRO, the number 1, at gmail.com. Today we want to continue our discussion of what is chiropractic. Last program we discussed the role of the chiropractic physician, the education and training required of chiropractic physicians, and we tried to clarify a few misconceptions that listeners might have concerning chiropractic and chiropractic care. Dr. Volstad, what can patients expect when they visit our office for the first time?
Well, that's a great question. And just like any doctor's office, there are certain procedures that we have to go through. Of course, there's paperwork, always paperwork. So patients will be filling out different forms that are required for the running of the office, for insurance information, etc. And in this day and age, new technology, we have to put all that stuff into the computer, so it does take a little bit of time. That's called an electronic health record. So all the information that the patient gives us on these forms will be transferred to an electronic health record so that it can be kept on the computer.
Right. And like any office, that only takes about 10 to 15 minutes, just depending on how fast you write.
That's right. That's right. But like any doctor's office, you're always going to have to do the paperwork.
Sure.
Then, once the paperwork's inputted into the computer and all the information is gathered that we need in regards to that information, then we begin the process of a thorough history and examination. And this is, in my opinion, the most important part of your first visit. Mm-hmm. It's where the patient and I will get a chance to talk and find out what's causing the problem that the patient may have, find out how it occurred, what kind of extenuating circumstances are involved, that sort of thing. That's called the history. Then we'll go into the examination. That's where I'll check out the body, find out what kind of problems there are, try to figure out the nature of the injury. It is not uncommon that after reviewing this information that I think the patient might need an x-ray. Fortunately, we have an x-ray machine right in our office, so we can take the x-rays right then on that same visit. However, sometimes your condition might require additional diagnostic testing, such as an MRI or maybe some blood work or any other pertinent lab information. And if so, then I would refer you out for that information.
And Dr. Volstad, you mentioned going out for an MRI or blood work and that type of thing. I think that's might be one of those misconceptions we were talking about. People are surprised to learn that you can send them out for an MRI. They sometimes think, oh, no, I've got to make another doctor's appointment to go get a prescription for an MRI. And
that's true, and it can be a frustrating thing to have all these different doctor's appointments, but you're absolutely right, Laura. This is something that we can prescribe right in our office and get the script that you need to send you off to get the necessary information that we want in addition to what we've already ascertained while you're in our office. Once we get all this information together, then we go to the next step where we then come up with a diagnosis. What's wrong? What exactly is the nature of your condition? And from that diagnosis, then we can prescribe the appropriate treatment and treatment plan. This is the adjusting, any physical therapy modalities that we may need, things of that nature, such as EMS, such as ultrasound, laser, etc.
Well, there's a word, EMS. What does that mean, Dr. Volstad?
Well, let's finish out this part of the program, Laura, right now, and we'll talk about that here in a couple of minutes. Okay, once we have the treatment plan done, then we are going to get you some educational information. Very commonly, we'll have some kind of health sheet waiting for you when you check out so that you can have information relating to your condition to help further your understanding of what I'm finding wrong and what I think we need to do about it. And then obviously we have the follow-up appointments as necessary to treat you and your condition.
The whole thing. Now that you've determined the patient's condition, what type of treatment do you typically use to help them?
Yeah, this leads back to that question you asked in the last segment about what is EMS, and I told you let's wait until the next part of the program.
Ah, yes.
Now's when we're going to talk about that.
Here we go.
Okay, what kind of modalities and treatments would I provide the patient? Well, most chiropractic offices have very similar modalities and treatment facilities. So you can expect to get this type of treatment in most every chiropractic office you may happen to visit. Of course, the most important and primary mode of therapy a doctor of chiropractic would provide is spinal manipulation. Spinal manipulation can be hands-on. In other words, they use their hands to do the adjusting. Or there is an instrument called the activator, which is a more gentle form of adjusting, where a tool gives a gentle thump, and we lovingly call this tool the thumper. But spinal manipulation is the primary form of therapy that a doctor of chiropractic would utilize. Now, there are quite a few physical therapy modalities that are utilized. In the previous section, like I said a few minutes ago, we referred to EMS. EMS stands for electrical muscle stimulation. And in our office, we don't use the old-time high-volt galvanism machine, but rather the newer form of electrical current called interferential current. Interferential current is a physical therapy tool that utilizes the properties of electricity to reduce pain and relieve muscle spasm. This can be done by controlling the frequency of the wave, by the intensity of the voltage. But the thing to remember for you electricians out there, the amperage is very, very, very low. That's why this is a modality that doesn't cause any discomfort or pain.
That sounds like one of those scary young Dr. Frankenstein things.
Yeah, the amperage is very, very low. We're talking milliamperages here. So the power of the current is very, very small. It's not like sticking your finger in a socket, that's for sure.
In fact, we have a couple of patients for whom, actually more than just a couple, but a few for whom this is their favorite thing. One in particular I'm remembering, he likes to come in at our last morning appointment, and I don't even turn the clock on for him. He likes to nap through it. It's like an unattended massage.
It is very, very comforting, and I remember when I was in chiropractic school, we as students could get treatment for $1, and we would have students after student after student lined up in the treatment room receiving this type of electrical current, and you'd hear the guys in there snoring. They would fall asleep. This is such a relaxing type of therapy.
Yeah, it's a good price too.
Yeah, $1. It's try and get that today.
Yeah, that's the spa treatment portion of the show when you come to our office.
Okay, another type of therapy that we would utilize in our office anyway is a cold laser. A cold laser is a device that has specific frequencies of light, more towards the red end of the spectrum, that stimulates the healing process in injured cells. And Laura, I know we could spend an entire half-hour program talking about the science behind cold laser, and we may do that one of these days, but just let's suffice it today to say that it's a device that helps the healing process in injured cells. Another mode of therapy that we use in our office is myofascial release, sometimes known as trigger point therapy. This is a type of massage which can reduce muscle spasm and help eliminate trigger points. Trigger points are those hard nodules that you might feel in the muscles of your shoulders, and it's very, very tender. And a lot of times when you stimulate or push on these points with your fingers, the patient talks about how, oh, doc, that hurts so good. And it really, really helps relieve a lot of their discomfort.
Are you talking about the points on your shoulders where ladies get this a lot? You know, we're sitting on our desk with our elbows up on our desk for long periods of time, or unfortunately, some of us have our keyboards for our computers up on our desk, and you're not in the correct position. Your shoulders are up, and after about, 20, 30 minutes of doing that, your shoulders start to burn right in that area. Is that what you're talking about?
That's exactly where I'm talking about.
That hurts.
And they are very uncomfortable. They can lead to things like headaches, etc., etc. So relief of these trigger points is a very, very useful tool in the chiropractic office. Another form of therapy that we use in our office is mechanical traction. And I'm including in this a flexion distraction therapy, also known as Cox's therapy. This is a modality that helps improve flexibility of the spine. It helps reduce irritation of the joints. And I think this is probably my personal favorite. A lot of times I'll just go after hours and lay on the mechanical traction table, and Laura will come in and wake me up because I'm snoring too loud. Another form of mechanical traction, a specialized form I would say, is spinal decompression. Spinal decompression is a computerized controlled traction unit that's specifically designed to help disc injuries, bulging disc injuries in your lower back and also your neck. In other words, because it's computerized and controlled by the computer, the traction can be modified during the course of care to pull at 100% and then relax to, let's say, 60 to 80%, and then pull to 100% and then relax to 60 to 80%, and create a kind of milking action of the bulging disc to try and reduce the bulge and help then the patient to heal and really relieve the pain. A great, great therapy for herniated discs. Okay, another form of therapy that we use in our office is acupuncture. As I mentioned last week, I am certified under my license to practice acupuncture, and I use acupuncture when needed. And like I said it earlier on the cold therapy, we can spend another edition of the Chiropractic Corner just to talk about acupuncture, what it is, and how it can be utilized. An additional therapy tool that we can use is ultrasound. Ultrasound is a therapy that helps reduce muscle spasm by bringing warmth to an injured area. The sound waves can penetrate the skin a few centimeters to increase blood flow through an area, to bring warmth to the area, and sometimes helps facilitate the recovering process for the patient. And of course, we use ice and heat, and this is very commonly a home instruction that I give patients, to use ice and rarely to use heat. Another device that we have in our office is the Magnosphere, which utilizes magnetic resonance therapy. The Magnosphere is a device that restores a more normal electromagnetic energy to the cells of the body, thus facilitating healing within the cells. And I can tell you that we will be spending on a future edition of the Chiropractic Corner talking just about the Magnosphere and magnetic resonance therapy. It's interesting to note that the developer of this protocol and the scientist behind the science actually lives right here in Jupiter. So maybe we can get him on our show at a later date.
Oh, that would be great. This gentleman is a fascinating guy to talk to. He's been working on that for many, many years. But in the meantime, if someone would like to come and try the Magnosphere out, they can just call our office and make an appointment for a complimentary session that takes about an hour and 15 minutes all told. But you're more than welcome to give us a call and come take it for a test run.
Another form of therapy that we use in our office is nutritional and dietary management. Some conditions require, in addition to physical therapy modalities, requires nutritional and dietary management. And then lastly, I want to remind you that it is not uncommon that we refer to other healthcare providers as necessary. for co-management of your condition, or if it's something that we really are not capable of handling, we'll refer you out to the appropriate physician so that you can get the treatment that you require.
Now that we have all this information and the patient is ready to start their care, Doc, how often do patients have to return for follow-up care, and how long might healing take?
Care is an individual matter. However, most injuries include soft tissue, which can be a determining factor in length of care. For example, there are different grades of strain sprain, which are injuries to the soft tissues, that is, muscles and ligaments. Depending on the grade of strain sprain, the length of treatment then can vary. For example, a grade 1 strain sprain, which is basically just a stretching of the fibers of the muscle or the ligament, recovery can usually occur within 2 to 6 weeks. A grade 2 strain sprain, which is not only just stretching of the muscle and ligament fibers, but also maybe partial tearing of these fibers.
Ouch.
Healing can take, yeah, that hurts. Healing can take, up to 8, maybe 12 weeks. But then you have a grade 3 strain sprain, which is really a surgical matter. Another variable that controls length of treatment is the amount of pain and the chronicity of pain.
Chronicity, there's a big word.
Chronicity is a term that means old. It's been around a long time. Mm-hmm. Usually in conditions, the more chronic the condition or more chronic the pain, the longer the recovery and the longer the treatment time required. That's why it's never a good idea for patients to formulate in their mind the idea that, this will just go away, or, I'll feel better tomorrow. Because if you don't feel better tomorrow or the day after, now all of a sudden you've taken an acute injury and turned it into a more chronic injury, and the longer you wait, the harder it is to treat and correct the issue, so the longer your treatment's going to be.
Doc, sometimes patients don't come back for their follow-up visit after that extensive first visit. Why is that second visit so important?
You know, Laura, that second visit is the most important visit, in my opinion. The reason it's so important is because it helps me to determine the length of care. Most patients experience some relief immediately following that first visit. However, more relief is garnered after each successive visit. So that second visit really, really is important.
Doc, what about the insurance environment? You know, with the government getting involved in health care and the subsequent changes to health care insurance and who needs to be insured by whom, what's going on with that insurance environment? Patients always want to know, does my health insurance cover chiropractic care?
Laura, that is another great question. Most major insurance companies include chiropractic care in their medical coverage. And even the new legislation that's come out includes chiropractic care. However, that climate is changing. With the government getting involved in healthcare, things are going to change. There are increased deductibles. There are increased co-pays. And for the doctors, there's reduced reimbursement. And this is true for healthcare all across the board, not just the chiropractic physician's office. Hospitals and medical doctors and podiatrists, they're all feeling the pinch. Each office is different in how they handle insurance. Some offices will accept all the insurance companies. There are other offices that won't accept any insurance and are cash only. And then there are those offices in between. One other insurance aspect I'd like to talk about very briefly is Medicare. Medicare, as it relates to chiropractic, is very limited. So for all you people out there that are insured with Medicare, rest assured chiropractic is covered by Medicare, but in a limited format. Medicare will pay for only the chiropractic adjustment, and that's it. Any other service provided by the chiropractic physician is non-covered as far as Medicare is concerned. So if you need an x-ray, or if you get an examination, or if you have any physical therapy modalities, those services are not covered by Medicare and are out-of-pocket expenses. Now, as it relates to supplemental insurance, many patients think that, well, if Medicare won't pay for it, then my secondary or supplemental insurance will pay for it. That isn't necessarily true, and in my experience, most commonly is not true. If the service is not paid for by Medicare or covered by Medicare, then your supplemental insurance will not pay for it either. So you then have those expenses coming out of your pocket.
Doc, I want to revisit something you mentioned earlier. You mentioned that you give patients home instructions for pain relief between visits. Is there a particular case when the patient should use ice and when they might want to use heat?
There are some instances where the patient would want to use one over the other, and here's the rule of thumb that I like to use. If the condition is acute, that is, if it's less than, let's say, 48 or 72 hours old, ice is definitely indicated. After 72 hours, there is some discussion as to whether heat is better or whether ice is better. For me personally, I think that I would prefer the patient use ice. I believe ice is a better pain reliever, and it helps reduce the inflammation and swelling. However, sometimes patients ask me, well, Doc, is it okay to use heat? And I think the answer is, under some circumstances, yes, it's okay to use the heat. However, I have to tell you, I would never recommend that you sleep on a heating pad or that you even sit with the heating pad for an extended period of time. The problem that you run into when you do that is that it will literally increase the inflammatory process and most likely the swelling. So I would not advocate sleeping on a heating pad or sitting on it for an extended period of time.
Doc, when you say extended period of time, can you give me minutes? Define it for me if you can.
Well, I think that an extended period of time would be anything longer than 10 minutes.
Ah, okay.
If the patient's disciplined enough to get off the heating pad after about 10 minutes or so, the chances of there being some increase in inflammation and swelling is greatly reduced. And I do understand heat feels good. Mm-hmm. So maybe using it only as a limited modality, like I said, less than 10 minutes, then I think I could live with that.
What about using them together? Would you alternate between heat and ice?
Gosh, Laura, I'd let you be the doctor because I kind of forgot about that.
No, thank you.
Of course, that's a great way to treat strain sprain injuries. Alternate between ice and heat. And the old rule of thumb that I was taught and that I would recommend for patients is 5 minutes of ice followed by 10 minutes of heat, followed by 5 minutes of ice, with another 10 minutes of heat following that, and then ending up with 5 minutes of ice. That's a great way to kind of milk the area and to reduce the swelling and inflammation. And one last thing I would recommend for home use for patients is a balm. An example of a balm would be BioFreeze or Tiger Balm, that sort of thing. Now, we use BioFreeze in the office, and patients just really seem to love that, and that would be part of the home instructions that I would give a patient as well. 10 minutes of ice followed immediately by BioFreeze, and then about an hour later, 10 minutes of ice followed immediately by BioFreeze, and so on throughout the course of the day, or as often as you could.
Now, Doc, I know we carry BioFreeze in the office. That's one staple we're never without, but I don't believe that's available at a retail level. Is that correct? People would have to go to their chiropractor's office or,
some healthcare
facility
provider's office, right? That is not purchasable through a retail outlet as far as I know.
Some people have devices similar to our EMS therapy machines, most commonly called TENS units, for use on muscle strains and pains. Are they the same as the EMS units in our office?
They are very similar, but they're not exactly the same. The electrical modality machines that we have in our office are a little bit more sophisticated, have a little bit more variability as to therapeutic effect. However, they are along the same lines, yes.
And can they use that in place of chiropractic adjustments when they're injured? I know we're asked that on, every once in a while.
I wouldn't say that they could be used as a substitute for, but certainly they could be used as an adjunct at home. After your visit, if you're starting to hurt a little bit later in the day, I certainly would recommend that you put the TENS unit on and utilize its therapeutic effect to help relieve some of your discomfort and maybe even reduce a little bit of your muscle spasm. So I am definitely a fan of the TENS unit.
Well, there's a wrap on another edition of the Chiropractic Corner. Here's a closing tip for you and yours. It's mosquito season again. If or when you're a victim of those little bombardiers, you can kill the itch by rubbing the bite with the inside of a banana peel. Really, it really works.
And I can attest to that. I am one of those that if you walk outside with me, you won't be bothered a bit by a mosquito because they'll all be on me.
Oh, that's right. I love for you to accompany me outside because I know they're going to leave me alone and make a beeline for you.
And I can tell you that rubbing it with the inside of a banana peel really does work. It relieves that itch.
Aren't you glad I told you that one?
I am very happy that you told me that one. Laura and I would like to thank you for listening this weekend. And remember, we'll be back again next week with another edition of the Chiropractic Corner. And please remember, email us your ideas and your questions. You can send those emails to iamchiro1@gmail.com. That is I, M as in Mary, CHIRO 1@gmail.com. Until we meet again, be well, live well.